Here are 5 FDA-approved treatments for symptomatic fibroids. Hello, I'm Dr. Obama, an OBGYN doctor. In today's conversation about fibroid treatments, we're going to talk about these FDA-approved medications that are being used to treat fibroids. 1, birth control pills. These are usually a great option that we discuss with patients, used to treat heavy bleeding and pain that's associated with their periods and as a result of the fibroids. A drawback with this treatment option is that it could cause the fibroids to slightly grow a little bit more. And that's due to the hormonal aspects of the birth control, because fibroids will grow with response to hormones. For some women, though, the benefit of controlling their pain, the heavy bleeding with this option outweighs the risk that the fibroids may grow a little bit more. 2, gonadotropin-releasing hormone agonists. These are things like Lupron, Luprolide. These help to shrink the fibroids and stop menstruation because they are working at the level of the hypothalamus, which then decreases the feedback and the production of the hormones which cause the fibroids to grow and which control menstruation. Use of Lupron is often limited to about 6 to 12 months because of the side effects that come with decreasing estrogen production. That means stopping estrogen production could lead to things like bone loss, osteoporosis, vaginal dryness, night sweats, almost sometimes putting some patients express this as them feeling like they're going through menopause or they are being put into menopause. These symptoms, however, can be remedied or improved by taking low-dose estrogen or progesterone to help with the symptoms. 3, gonadotropin-releasing hormone antagonist. These are things like Orlistat. It can be used to manage heavy bleeding that's associated with your periods for about 2 years. The thing to remember about it is it doesn't shrink the fibroids, and it often requires prior authorizations from insurance companies, and sometimes it's a huge pain to get it approved for my patients. 4, progesterone-releasing IUD or intrauterine device. Now, these are only useful in situations where the fibroid is not distorting or interfering with the shape or the normal lining of the uterus. And so the IUD can be placed inside of the uterus and it will help disseminate the hormone progesterone directly to the uterus. It does not treat the fibroids themselves. Lastly, tranexamic acid or TXA. This is often prescribed or used only in a limited fashion, particularly to help stop acute heavy bleeding that may happen during periods. It does not completely stop periods or stop the fibroids from growing. I hope this was educational and helpful. As always, consult with your healthcare provider to pick the right medication for you and to assess your individual symptoms.